नहमदुहु व नुसल्ली अला रसूलिल करीम बिस्मिल्लाहिर्रहमानिर्रहीम। मेरा नाम डॉक्टर हसन महमूद तबस्सुम है। मैं प्रोफेसर ऑफ सर्जरी और कंसल्टेंट सर्जन हूँ। इन वीडियो को बनाने का मकसद PGRs को, अंडर ग्रेजुएट मेडिकल स्टूडेंट्स को एग्ज़ाम की तैयारी कराना है और कंसल्टेंट प्रैक्टिशनर्स को और GP प्रैक्टिशनर्स को आगाही देना है कि कैसे जो है वो बीमारी प्रेजेंट करती है, कैसे बीमारी जो है ना एग्ज़ामिन करनी चाहिए, कैसे डिजीज़ को इन्वेस्टिगेट करना चाहिए, कैसे जो है ना डिफरेंशियल डायग्नोसिस बनानी चाहिए, कैसे डायग्नोसिस बनानी चाहिए और फिर कैसे पेशेंट को काउंसल करना चाहिए और फिर पेशेंट को कैसे ट्रीट करना चाहिए। आज हम जिस टॉपिक पे डिस्कस कर रहे हैं वो है ब्रेस्ट डिजीज़ेस। Breast diseases are very common diseases, and the patients with breast disease, they present with the pain in the breast, lump in the breast, discharge from the nipple. They present from the generalized swelling of the breast, and they present with the metastasis of the breast tumor, breast cancer. So we should be vigilant for every aspect of the things. So what to examine? In the examination, we know that there are two breasts consisting of nipple, areola, and then the breast. Nipple, areola, and the breast. These are lymphatic drainage of the breast to the axilla and internal memory lymph nodes. And supraclavicular lymph nodes. It is essential in the examination in the short cases that you should examine the nipple, areola, and the axilla of the both sides, both breasts, they should be examined simultaneously. And the supraclavicular lymph nodes should be palpated, and the history of metastatic tumor in the brain, bone, lungs, they should be evaluated. And adrenal metastasis, they should be evaluated. So we see that the breast diseases and the swelling are of two types. One are localized swelling and one are generalized swelling. Localized swelling, that may be a localized breast abscess, This may present with pain, with swelling, with redness, with tenderness and fluctuation. Breast abscess. This may be lactational breast abscess or this may be non-lactational breast abscess. Lactational breast abscess is from the mouth of the lactating baby. The Staphylococcus aureus infection that comes to the mouth of the lactating baby and then involves the cracked nipple of the mother and leads to lactational abscess. This may be, and if antibiotics are given to these and they are sterilized, they lead to antibioma. Antibioma is painless swelling in the breast that is due to sterilized abscess due to antibiotic treatment and non-drainage of the abscess. Then there may be fibroadenoma. Fibroadenoma are in the young ladies. They are discrete swellings. They may be single or multiple. They are neither attached to skin nor to deeper tissues, and their lymph nodes are usually not involved. Then there is another cause of localized breast abscess. This is the most important cause and the concern within the world, that is carcinoma of the breast. Carcinoma of the breast, one among the 12 ladies, they suffer from the carcinoma of the breast. One among the 12 ladies. So carcinoma of the breast is very common and very dangerous condition. It can be cured if it is diagnosed early, carcinoma of the breast. But if it becomes late and spread to the lymph nodes, to the brain, to the bone, to liver, lung, renal, then it will become very difficult to cure this disease. We will have another video for this carcinoma of the breast, including all aspects of the carcinoma of the breast. Another condition that leads to localized abscess, localized swelling, that is ND. ND is aberration of normal development and evolution. ND is actually the female breast is under stress throughout the life. At the time of birth, under hormonal changes from the mother, they are shifted to the baby and the rich milk that comes in. And at the time of parturition, there are hormonal changes. At the time of menses, there are hormonal changes. At the time of menopause, there are hormonal changes. So it is under the stress. So these changes leads to the cyst formation, adenosis, cyst formation, adenosis, papillomatosis, and fibrosis. So these things they should be kept in mind and diagnosed accordingly and treated accordingly. These are usually non-dangerous conditions. Occasionally we encounter a subareolar abscess and the ductectasia, subareolar abscess and ductectasia. There is an abscess underneath the areola and the duct that becomes dilated, and infection that leads to the formation of subareolar abscess. Then occasionally we encounter lipoma of the breast, sarcoma of the breast, and very occasionally the lungs, liver, and other primary sites may metastasize to the lungs, metastasize to the breast. So this metastasis that should be confirmed by the biopsy. Then there are generalized swelling of the breast. One among them is inflammatory carcinoma of the breast. This is very important to diagnose that this is inflammatory carcinoma of the breast. It is mimic-like inflammation. It involves the whole breast. Whole breast, axilla, and arm. So lymphedema of the arm that can set in with this within no time. So it mimics like inflammation and inflammatory carcinoma of the breast that should be diagnosed very early. Then there is another condition that is known as hypertrophy of breast. I have seen 2-3 cases of hypertrophy of the breast that is under estrogen and other hormonal changes at the time of puberty. The breast enlarges to enormous size, and they may come to the after the side of the knees. This is hypertrophy of the breast, and this is bilateral condition, and that needs reduction mammoplasty. So this is the brief review of the conditions of the breast that leads to swelling of breast swelling, that lead to breast swelling. Then what to see is the breast. That is, we have to see that there are two breasts. There is nipple, there is areola, there are axilla, there is supraclavicular lymph nodes, and there are internal mammary lymph nodes, and there is arm. There is upper limb, right and left upper limb. So all these should be examined in short cases, and there should be history taking in the short cases. So what to investigate? The first initial investigation is ultrasound. Ultrasound tells us that whether it is cystic swelling or a solid swelling. It tells us whether it is a cystic swelling or a solid swelling. And there are gradation between cystic and solid swellings. So this gradation and cystic and solid component that leads to the clue to the diagnosis. And another thing is that is known as mammography. Mammography is not effective for young ladies. It is for old ladies where there is no fat in the breast. The fat that is enemy of the mammography. The findings of mammography, they are wasted when the breast is younger. Then we have to go for FNAC and core cut biopsy. It is meant for the definitive diagnosis of breast disease, whether it is inflammatory, whether it is carcinoma, what is fibroma, or what is the nature of the disease. Specific nature of the disease is that it comes to know by the core cut biopsy. FNAC, a fine needle aspiration cytology, that tells about the cells in the tumor, while the core cut biopsy that tells us about the tissue biopsy. There is a tissue biopsy, is told of the ducts as well as the cells as well as the connective tissue, another component of the breast. So it is more definitive diagnosis. When we gather these informations, then we have to do the triple assessment. Triple assessment is very mandatory nowadays. So the three things, they unite with each other. They are combined results. They are processed. So this leads to a definitive diagnosis of 99% of the cases. Triple biopsy. Triple biopsy gives rise to 99.9% diagnosis. This comprises of age of the patient and clinical examination of the patient, ultrasound of the patient and core cut biopsy. Ultrasound of the patient and it leads to the mammography. And then is a core cut biopsy. Biopsy and FNAC. This is now a recommended method of investigation the breast lumps. So it will tell you 99.9% diagnosis is verified by this means and a definitive decision that can be taken. So in the carcinoma of the breast, we have to take many other things in considerations. The receptor status, the molecular status, the X-ray chest, the CT brain, the X-ray and the CT of the spine, and the painful conditions where the metastases are there. They should be evaluated for the extent of the disease. With the help of these things, then we have to counsel the patient. It is very important that we should discuss treatment options with the patient and their effects and side effects. This is known as counseling. It encompasses age of the patient, disease of the patient, extent of disease, treatment options, what treatments are available for this, and cost of the treatment, comorbid conditions, allergies, addiction, hospital stay, treatment options. They should be with the alternate treatment. Alternate treatment or no treatment at all. What are the effect of no treatment at all? So after the counseling, then we can offer the treatment to the patient. The treatment that can be given is dependent on the disease of the patient. For example, if there is fibroma, fibroma, that it needs excision. If it is Phyllides tumor is a large benign tumor, but at time it may be a malignant tumor. It needs extensive excision with margins. If there is breast abscess, they should be drained. Breast abscess, they should be drained meticulously, so as the wall of the breast abscess should not remain behind, and recurrence they should not occur, and the fistula formation, there should be no fistula formation for that. Then there is inflammatory carcinoma of the breast that needs early detection, as well as chemotherapy, radiotherapy, surgery. For the new adjuvant therapy is given. New adjuvant therapy is chemotherapy that leads to cytoreduction of the tumor. The tumor becomes operable, otherwise it is difficult to operate this patient. Then is the carcinoma of the breast. Carcinoma of the breast, as we have seen that carcinoma of the breast is not only localized disease, but it is generalized disease. To begin with, the carcinoma of the breast is treatable, curable disease by surgery only. But if it is advanced, it needs chemotherapy, radiotherapy, surgery, hormonal therapy, immunotherapy, molecular treatment, and treatment for metastasis. Metastasis may be in brain, bone, lungs, liver, adrenal. It may be even metastasized to the abdominal cavity, and under digital rectal examination there may be palpable mass in the lower part of the rectum and anal canal. That is known as Bloomer shelf. So this is a brief review and full preparation for the postgraduate medical students for the examination, short case examination. So you like it and share it and subscribe it, so you should have one more videos. अल्लाह आपको खुश रखे और आबाद रखे। डॉक्टर हसन मैं मुतबस्सम, न्यू सलीम गार्डन, मौजा बुरुड़ा, 11 शर्की, रहीम यार खान।